So the risk factors can be grouped into two categories, things we can control and things we can't control. The things we can control are things like smoking, diabetes, high blood pressure, high cholesterol, level of activity, lifestyle things such as diet and exercise. Things we can't control are things like gender, how old a patient is and what their genetic predisposition for disease is. When people come to the hospital, they typically are asked if they have chest pain. And that's probably not the best thing to ask a patient because not everybody describes their symptoms as pain. Most people describe their symptoms as chest discomfort, either burning or pressure or tightness. They may have pain that goes into their neck or their arms or their back or into the pit of their stomach. They may feel nauseated. They may have sweatiness. They may have heart racing. They may feel short of breath. They may feel lightheaded. They may have any combination of all those things or just one of those things. Categories of patients that are unusual are patients that are female and patients that have diabetes. And that group of patients tend to have less common symptoms. So they may not have chest pain or chest discomfort. They may only have shortness of breath or only have nausea or only feel a tight sensation in their throat or their neck. And so there are a variety of things that we typically call chest pain, but in reality it should probably be called chest discomfort. So people that have any one of those signs or a multitude of those signs, a combination of those signs, should take it very seriously. Even if it's self-limited, even if it only lasts a short period of time, that could be a warning of an upcoming heart attack. So they should seek medical attention right away. And if they have symptoms that don't go away in a very brief period of time on their own, they should dial 911. The most common mistake people make, especially in the state of Mississippi, is that they try to drive themselves or have someone else drive them to the hospital or to their doctor's office, thinking that they're having indigestion or something else is going on. And they think they can get there faster, and a lot of times that is true. They can get in their car and get to where they want to be faster than waiting on an ambulance. That's not a safe thing to do though, because the difference between the patient's car or their friend's car and the ambulance is the fact that the ambulance can monitor the patient, monitor their blood pressure, monitor their heart rate and rhythm, and those are the things that can get patients into trouble before they're able to get themselves to the hospital. So what I would tell most people is if they are having chest discomfort or any one of those symptoms we talked about, that they should call 911 and have an emergency crew come pick them up and take them to the hospital.